Hey, what's going on, guys, and welcome back to another video of Keep It Simple Stupid. And today I'm just going to be making a quick video on neuromuscular blocking agents, or NMBAs for short. Specifically, I'm going to discuss two different types, rocuronium and succinylcholine, so that you might have a better understanding of differentiating between these two. And then again, just wanted to reiterate here that NMBA simply stands for neuromuscular blocking agent. Pretty straightforward. All right, so NMBAs. The next question is going to be, when are they used? So if you think about the name, neuromuscular blocking agent, they're used to essentially paralyze a patient. When this becomes important, most commonly is going to be RSI, or rapid sequence intubation. Generally, when you're trying to perform an intubation, you're going to want the patient paralyzed to allow things to go more smoothly. Obviously, there's going to be indications where you would not want to paralyze a patient. We're not going to get into that for the scope of this video, but generally, think about when are these medicines administered, and that's going to be when you're performing a rapid sequence intubation. All right, now an important distinction here is that there's actually two mechanisms for NMBAs. There's actually going to be a depolarizing component and a non-depolarizing component, and I'll go ahead and discuss which medicine falls into which class. So next, I have my drawing of a neuromuscular junction here. Now what you need to know is that you're going to have acetylcholine that is released that binds to nicotinic receptors that stimulates the contraction. That's normally how this works, but with succinylcholine, it actually binds those same receptors and depolarizes the muscle. So if you think about the depolarizing aspect of this, you will actually see fasciculations as succinylcholine is depolarizing the muscle, and then following that, you have the period of paralysis. And then finally, just remember, succinylcholine is depolarizing. All right, let's go ahead and move forward. So here's our second drawing of a neuromuscular junction, and this is going to represent rocuronium. Okay, now the difference here is that rocuronium is a non-depolarizing agent. Okay, now the same thing here. Acetylcholine will try to bind to those receptors, but they won't be able to. And that's because that rocuronium is essentially preventing them from activating those receptors and depolarizing, causing a contraction. So I hope that made sense a little bit there. So succinylcholine, you are actually activating those receptors and causing the depolarization, whereas rocuronium is blocking acetylcholine from touching those receptors. Therefore, it cannot depolarize and cause a contraction. I hope that's helpful. Now let's go ahead and discuss some of the differences between the two medications. So next up here, I just created a quick little table kind of breaking down some of the differences between the two medications. Now let's go ahead and get into it. Now the first thing we're going to discuss here is how quickly after you administer this medication do you begin to see the effect of it. And with succinylcholine, you will see an onset within 45 seconds. Whereas with rocuronium, it'll take about 60 seconds. Next, we're going to discuss the dose. Now for succinylcholine, you're going to generally go with 1.5 milligrams per kilogram IV. Whereas with rocuronium, it's generally going to be about 1.2 milligrams per kilogram IV. And then the next question here is going to be recovery time. So with succinylcholine, following administration of the medication, it will take about 15 minutes before that patient is able to spontaneously breathe again. Whereas a big difference here with rocuronium, you're looking at about 45 minutes. All right, the next question here, say you push the medicine, you want to know, can the effect of this paralytic be reversed? Succinylcholine, the answer is no. Whereas with rocuronium, the answer is yes, via a medication called Sugamidex. And then finally, contraindications. So we'll actually start with rocuronium, and per Rosen's, which is the textbook I used to pull this information from, there are actually no contraindications to rocuronium. Whereas with succinylcholine, there are quite a few specifically related to hyperkalemia. And that'll be the last component of this lecture, as I will discuss those. In the final component of this lecture, I'm going to just very quickly discuss the contraindications to succinylcholine. And it's important to remember that they are all related to hyperkalemia. I'm going to go ahead and write them out. So I went ahead and wrote out some of the different contraindications to succinylcholine. Now I'm going to go ahead and walk through them. So the first one is going to be burns, greater than 10% body surface area, crush injuries, denervation, so that's going to be stroke or spinal cord injury, intra-abdominal sepsis, and then finally neuromuscular disorders, so think ALS, MS, or muscular dystrophy. Now, the final important component here is that in the specific contraindications, it's important not to give succinylcholine. It's greater than 5 days after the injury. So does that make sense? You just can't give it greater than 5 days post-injury. And then the important component for neuromuscular disease, again, that's like ALS, MS, muscular dystrophy, that's going to be indefinitely. So never use succinylcholine. In these instances, you'd want to use rocuronium. All right, guys, well, that's all I had for you today. I hope that was helpful. If you have any questions, please let me know. Like, comment, subscribe, and I'll see you next time.